but benign disease. Now it's very different because thanks to echo-duplex and the clinical approach, we can identify all conditions at risk of this disease. The first point, very important, is to define the superficial vein thrombosis on healthy veins and the superficial vein thrombosis on varicose veins. This is two different words from the clinical point of view, from a etiological point, from therapeutical also. And there are also some difference in the histological aspect of this disease. The superficial vein thrombosis is a etiological heterogeneous group of disorders with a different degree of inflammation and thrombosis. Here you can see the list of very important risk factors, and you can see at the end the varicose vein because it's a more representative group of this pathology. But, what is the superficial vein thrombosis? We have the traumatic and the iatrogenetic thrombosis. Very important, the intravenous infusion and for catheter or for sclerotherapy. But we have also the condition in different infections. Septic, in this case, we can speak about septic phlebitis or suppurative phlebitis. There is
Lascio così?
Vabbè, se taglia un pochino del titolo, non importa. Very important chapter is the migratory phlebitis or migratory superficial vein thrombosis because this condition is strictly linked to the neoplasia or different tumors. Not only, but also the Buerger disease is representative of migrant superficial vein thrombosis. The Mondor disease, there is the title cover, but is the Mondor disease is probably the only benign disease because it's a little superficial thrombosis, normally of the breast or anterior chest wall, and in 10-15 days solve without therapy, without any hour activity. But the very important chapter is the varicose vein. The varicose vein is the best chapter of the superficial vein thrombosis. You can see here the characteristic of thrombosis of the varicose vein. So we have to define correctly the etiology of this disease, and in absence of varicose vein, we have to search the other reason, such as malignancy, autoimmune disease, Buerger disease, or inherited condition and tendency to clot. The differential diagnosis of this disease is listed here. Cellulitis, deep vein thrombosis is a complication of superficial vein thrombosis, and so on. To remember also the post-thrombotic syndrome is very important as a secondary condition of superficial vein thrombosis with extension to deep system. The diagnostic criteria is, of course, very important to define the